Catherine. I'm going to be your student nurse today, so I'm going to give you some pointers as far as prevention for certain infections. I'm going to go ahead and start off with bacterial vaginosis. So what you do want to look out for, some signs and symptoms, are like foul smelling, white or gray, or thin and wet discharge, or you may be asymptomatic. And some risk factors can be if you have like new or multiple partners, if you're engaging in unprotected sex, or if you do use a douche, because that can actually alter the pH balance. And a prevention measure would be using condoms.
Is this gonna hurt my baby?
So there is no information saying that your baby can get it through direct contact, but however it can lead to rupture of the baby's membrane, which leads to preterm birth and low birth weight. So there is a medication that you can take for bacterial vaginosis. It's metronidazole, and you can take it orally or topically, and you do want to avoid sex while you're taking it. So some just like precautionary measures, you can actually avoid from wearing tight-fitted clothing because that doesn't help with the infection. Also like cotton-lined underwear, and in general just practicing safe sex if you can stay with one partner if possible, and just always using condoms. So we're going to go ahead and move on to candidiasis, and this is actually a fungal infection of your vagina. So what you want to look out for is like signs and symptoms going to be like thick, creamy, white, cottage cheesy type discharge, or if you have like pain while urinating or pain during sex. And some risk factors could be if you're on immunosuppressants, combination oral contraceptives, or if you pregnancy as well can cause like an alteration in the bacteria in your vagina.
How would this affect my baby?
So there actually is information like regarding the baby getting it like through direct contact through the vaginal canal. The baby can get it through the mouth or genital area, and this actually results in the baby getting a bacterial infection in their mouth. So they'll actually have like a white appearance on their tongue or their throat. So you do want to look out for that. So there is a medication for candidiasis. It's actually, you can take any topical azole, but you do want to avoid fluconazole because that can actually affect you in your first trimester, and you don't want to take any oral medications whenever you're pregnant. So it's best to get rid of the yeast infection or the fungal infection before you even get pregnant. And some precautions that you can take also are not wearing any damp clothing, also using cotton-lined underwear as well, not using any scented feminine products, and absolutely no douching. So do you have any additional questions regarding infections or overall?